I'm officially 23 days post-op from my endo excision surgery. I am doing super well. I'm definitely gonna do another video breaking down what my symptoms were, what my health journey was, and the results in my surgery. But I realized that I don't have a video on this channel explaining what is endometriosis. One of the most popular 20 painful conditions. Hey friend, just a disclaimer. The information provided in this video is for informational purposes only. It's not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your doctor or other qualified health provider with any questions that you have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something that you've heard in this video. The content shared here is based on my personal experiences and research and may not be applicable to everyone's situation, so use this information at your own discretion. And all the sources for the information that I spoke about in this video will be provided in the description below. Endometriosis, it's also called endo, is a chronic whole body disease that currently does not have a cure. It affects 1 in 10 women and people who menstruate. Endometriosis is when there is tissue that is growing in the body. It's abnormal tissue. It's very similar to the tissue that's within the uterus called the endometrium. So the endometrium is the tissue that is shed each month during the menstrual cycle. So it's similar to the endometrium, but it is not endometrium, okay? So it has been often mislabeled as a period disease, and it is not a period disease. It's commonly found by reproductive organs, so it will grow either on or near the uterus, the fallopian tubes, the ovaries, but it also grows throughout the pelvic cavity. So it can be on or near bladders, bowels, appendix, rectum, the uterosacral ligaments, nerves, and then also the spaces in between the bladder, the rectum, the uterus, bowels, and vagina. Other cases, less common, it goes beyond the pelvic region, and that's where it's been found in the lungs, the diaphragm, the kidneys, and the brain. Y'all, what's so crazy about this disease? Highly recommend getting this book. A little bit of story time here. So in these women, also me, the presence of these cells, so the endo tissue that we were talking about, where they don't belong, it actually distorts the body's anatomy, it ignites an inflammatory response, and it increases the likelihood of autoimmune dysfunction and disease. So symptoms: painful periods, periods that last longer than 7 days, heavy periods. The biggest societal misconception is that painful periods are normal, and they are not normal, okay? Painful periods are not normal. Painful symptoms on your period are not normal. And this is the information that has been passing down generation to generation and is preventing a lot of people from getting the help that they need. Pelvic pain. Longer than 6 months is chronic, so pelvic pain that's happening outside of your menses, outside of your actual period. It could be pain that's happening during ovulation. Bowel disorders like IBS, a lot of women get an IBS diagnosis and it's actually endo. Pain and dysfunction, constipation, diarrhea, painful severe bloating, painful intercourse during any type of intimacy, unable to use tampons because they cause pain, infertility and pregnancy loss, fatigue, migraines, allergies that worsen around the period, asthma, coughing up blood, chest pain, chest pressure, hip pain, leg and lower back pains, as well as chronic fatigue. So urinary disorders, so we're talking about painful urination, bladder pain, kind of UTI symptoms that keep happening and aren't actually a UTI, like that you go and get a test and they're like, it's not a UTI, but it's presenting as a UTI. Incontinence, so if you sneeze or laugh or cough or jump and you urinate, that is not normal. Okay, so that is something that's another kind of flag. The result of this is a process of accumulating symptoms, but not for everybody, because not everybody has symptoms, right? So there are some women and people who menstruate who never know they have endometriosis. They're never affected by the pain that it can cause. On top of that, there can be spin-off ailments, right? So co-conditions besides the endometriosis. So like painful bladder syndrome, pelvic floor dysfunction, irritable bowel syndrome, sensitization of the central nervous system, not to mention anxiety and depression from all of these different changes and the pain that they're bringing. The frustrating part in all of this is that there currently is no cure. There's a gold standard treatment, which is excision surgery, which is cutting the disease out by the root instead of burning it off, which is ablation surgery. So excision surgery is that gold standard. Pregnancy, birth control, diet, menopause, hysterectomies, medications, none of that, and including the excision surgery, none of that cures the disease. You can only diagnose it by actually going in surgery and taking a biopsy of that tissue, and through that analysis, it can confirm or deny the endometriosis. A stat in this book that really freaked me out as a patient was the fact that there was a president of the American College of Obstetrics and Gynecology in March 2017 said this in a report. And I was like, no freaking way! This explains a lot of my experience and why it took me so long to get diagnosed. It took me 14 years, okay? 14 years. The average for someone to get a diagnosis is 7 to 10 years, okay? So 63% of general practitioners feel uncomfortable diagnosing and treating patients with endometriosis, and as many as half are unfamiliar with the 3 main symptoms of the disease. Page 2, y'all, page 2. It's really important to find an endometriosis specialist, that the surgeon that you work with, like that is all they do is endometriosis surgery. And a lot of them offer free consults, and a great place to find a list of different doctors and endo specialists is on the Nancy's Nook list. So there's a Facebook group that you can join, as well as on the website. And then there's another directory that I use to find my pelvic floor physical therapist called icarebetter.com. I believe it's .com, but I'll definitely double check that, and I'll put all those links in the description below. So if you are thinking that you or a loved one might have endometriosis, or you have some of these symptoms, super important to bring it up to your doctor. If you are bringing up your concerns and you feel like you are being dismissed or gaslit, it's really important to notice how you feel leaving doctor's appointments. And if you're feeling that frustration and you feel like you're not being listened to, it is not in your head. You are not crazy. You are not making this up. No one goes to the doctor and makes up feeling excruciating pain and debilitating symptoms that are affecting so many different aspects of their life. A lot of people go through that process before they finally find that doctor. It took me a very long time until I found an endometriosis specialist that really helped change my life. And just so close after my surgery, so many things have shifted. So I just really hope and pray that more funding goes into researching this disease, and that more people help break that stigma of talking about periods and talking about these symptoms, because again, painful periods are not normal. Chronic pain is not normal.
Hello, Layla. She looks so peaceful. Sorry for waking you up.